Cancer deaths among Americans under 50 have dropped by nearly half over the past 3 decades, but there's one exception. Colon cancer is now the deadliest cancer in Americans under 50. That's according to a new study. And joining us now to talk about this is Dr. Matt Scholzel, doctor of osteopathic medicine with Sharp Hospital. Thank you so much for joining us. Can you explain why deaths are going down for other cancers such as lung cancer, but we're seeing an increase in colon cancer deaths?
Yes, Kimberly. So we are seeing decreases in breast, brain, leukemia, cancers. However, colorectal cancer is increasing at about a 1.1% increase per year, and we're seeing it in younger patients. And I think the biggest issue is that age no longer is considered a protective factor against colorectal cancer. Actually, we're seeing advanced cancers in younger patients. So patients are just not getting screened early enough and are avoiding that 45-year age group recommendation. So in my practice, typically, and for me, colorectal cancer is near dear to me. My eldest brother had colon cancer at 40. My grandmother had colon cancer. It's now something I completely specialize in for my patient population. I'm seeing, it's very hard to get 45-year-olds to come in for their colonoscopies. And I think if they did that, we would catch these cancers earlier and it would be less deadly.
And I'm sure it's something with your experience with your family, and I'm sorry to hear that. I know that you will be looking at environmental factors, nutritional factors. What advice do you have for people? What could be causing some of this?
So we don't quite know what causes this increase. The hypothesis is that obesity is one of the big factors. Some of the things we're eating, our gut biome, and external environmental factors. Researchers are still looking into these things. I can tell you from seeing patients, and the trend is that I do see heavier patients, obese patients do tend to have more likely to have cancer in my patient population. Now, that may not be what's seen nationally, but I do tend to notice that increase in patients.
And even if you don't have a family history, who should be screened? And you hear a lot now about Cologuard and other things that you can do without doing a colonoscopy. What's your advice on that?
Sure, I get that question all the time in the office, actually, that most patients said, oh, I did a Cologuard, I don't need a colonoscopy. Not quite true. Cologuard is not a foolproof test. Typically, 45 years of age is the recommendation for patients. However, patients should not ignore obvious symptoms, rectal bleeding, fatigue without any sort of cause, a change in bowel habits, even difficulties going to the bathroom, or change in the stool caliber, or potential risks of maybe there's a cancer in there. The greatest thing about a colonoscopy is it's both preventative and diagnostic. So via colonoscopy can remove polyps that may turn into cancer. Cologuard can't remove anything. It's just literally a test that tells you yay or nay if you have the issue or not. And again, not foolproof.
All right, we all need to be tested, and we all need to think about our health very early. The younger and younger in the case of colon cancer. Dr. Matt Scholzel, thank you so much for joining us this afternoon.
Thank you very much.